Most of us, when we take our furry friends to the veterinarian, we think about that traditional visit. You know what I mean? You go to the clinic and then you take your furry friend into the patient room to get vaccines, flea treatment. You get the doctor to check them out while they're limping. You know, the list goes on. Then we expect to hear what the veterinarian's best case for treatment is. Usually, though, we don't think about things like nutrition, acupuncture, stem cells, laser and ozone therapy, and a plethora of other non-traditional treatments. In this episode, two very highly respected veterinarians, Dr. Angie Stam and Dr. Adam Lassen, join me, and they explain why in some cases traditional medicine just can only go so far, and how these newer, highly successful, non-traditional treatments can help our furry friends. And we want to use all the tools in the veterinary toolbox, right? This episode is one you definitely want to listen to. I just can't wait for you to hear it. We are supported by PrepVet, providing stem cell therapy for pets.
As a pet lover, did you know your pet can benefit from the incredible healing power of stem cell therapy? Prep Therapy offers a groundbreaking solution taken right from your pet's own blood. Say goodbye to joint pain, arthritis, kidney and liver conditions, and more. They'll experience faster recovery, increased vitality, and extended quality of life without the need for surgery or harmful drugs. Put the wag back in their tail and discover Prep Therapy today at prepvet.com. Save 10% with promo code FurRealPodcast, covered by most pet insurance.
For real, 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 for real. Got a bunch of furry friends and I love them all the same. I'm an animal lover, veterinarian is the name. Let's share some pet stories from heartwarming to strange, losses and gains, from wacky to insane. For real. You're now tuned in to For Real with your host, Mark Kyle.
Hey everybody, and welcome back to the For Real Podcast. Today's a special one. It's a two-parter, and I felt really lucky and privileged to have two of the top integrative veterinarians join me. In the very first half of the show, I've got Dr. Adam Lassen. Adam, thanks so much for joining, and I can't wait for everybody to hear what you got to tell us.
Yeah, thank you for having me on. I'm excited to be here and just discuss sort of our philosophies and approach to veterinary medicine.
Well, you've got a great philosophy. There's a lot of things on your website that I like, and of course, I've got to know you. One of the things I always tell everybody when I'm talking about you, because you're in Austin where I am, and I know you came out from California. I want to get into that here in a second. But one of the things, and this is a compliment to you, because of my work, and without getting into that, but I have an opportunity to talk to the pet parents. Without exception, everybody talks about, in the human side, it's, the doctor's bedside manner. Your bedside manner, according to every person I talk to, you spend a lot of time really getting to know the parents and the animals. And that's commendable, and it's impressive, and everybody loves it. So just so you know that, but let's get into your background.
Yeah, well, thank you for that. I do find it important to have a partnership with our clients and patients. And I think when you have a really strong bond with them, it makes it easier to practice really good medicine. You form really good trust. And, it makes things much easier when everybody's on the same page, and not working against each other. But I went to Ross University, veterinary medicine. I ended up going to Michigan State for my last year of vet school for our in-clinic year. And then after that, I ended up doing a 1-year internship in Long Island, a rotating internship where you go through all the different specialties. And while I was there, I started to realize that there was just something missing. And, you have the specialty, you've got the Western medicine, but there was not a lot of holistic integrative medicine. And, I felt that was something that was needed. And that's really where I think a lot of true health and healing can take place, when you really start focusing on, the root cause. And growing up, my family has always been into very clean eating, seeing an acupuncturist, going to a chiropractor way before it was ever really a thing. And so I realized, I don't want to become a specialist in surgery or oncology or emergency. And then I was like, I really enjoy general practice, but I don't enjoy just band-aid type of medicine where pet comes in, they're sick, you either prescribe them this processed kibble with, not the best ingredients, and here's your antibiotics or here's your allergy drugs, and then it becomes this just vicious cycle. And so that's sort of where my journey began. And I would say every single year there's a different version of myself practicing medicine. And so, yeah, I'm just excited, and I'm still excited every day I come to work and all the new people I meet, and just, watching all the different types of modalities we offer, help heal a lot of these animals who have chronic illness.
Well, you know that saying, if you're not learning, you're not growing, and the fact that you're constantly looking at new alternative things to treat animals makes it even better. It makes it more important to me. I want somebody that's ahead of the game.
Yeah, I mean, it's interesting what's sort of happening with the profession, but and what the clients are looking for. I would say, about 13 years ago, you would have this division. It was either like the rogue holistic vet who was the black sheep of the profession, and then just your general Western practitioners. And, that sort of has continued to grow. At the first practice I was at, I was told that you either have to do holistic or Western. You can't do both. And in my mind, I could never separate the two out, because I find that both of them are so important in the work that we do. And so that's where I really think this integrative functional medicine type of practice is going to continue to grow, and you're going to see a lot more clinics offering this type of medicine. I mean, we before the podcast we were talking about how all the vet schools are offering acupuncture now, and when I went to vet school, there that was not even a thing. So this is something that's growing, and I wish it was something that was growing from within the profession, but I think this is a client driven change, along with the pet food industry and all the things that are changing. A lot of this stuff is client driven. What do I mean by that? Well, over the last few years, there's been a lot of emphasis on clean eating, exercise, watching the ingredients you put in your body, eating organic and trying to eat as clean as possible. And so a lot of pet owners are saying, whoa, I'm doing this for myself, but what am I doing for my dog? And then, that sort of puts in the thought of like, well, I should be doing this for my dog. If I'm eating clean, then maybe my dog should be eating clean. But, years ago that wasn't an option, and now it's becoming more of an option. The hard part is we still have this division between the what the veterinary profession thinks is appropriate versus what type of change is coming.
Well, it's funny, and I absolutely 100% agree. I think it's the mindset, right? So I bring this up all the time on the podcast. What most people, and I think that, and I agree with you, I think that people are actually looking at it differently. What most people don't seem to realize, are starting to realize more, animals have the same issues we have. So if you think about diseases as an example, or injuries, it's exactly the same. They maybe have a little bit of different name or whatever, but it is. So if you think about yourself, you're going to do, if you've got a problem, you're going to find whatever it takes to get yourself better. And I do think the pet owners now are looking at saying, same thing. This is my best friend. I'm going to find whatever it takes to do that. I don't want just a traditional thing. I want to find a thing that works.
Yeah, and when I decided to open up Roots Integrative Veterinary Care, I thought to myself, if I were a client, and how would I want to be approached? What do I like, even as a person who goes into a doctor's practice for like a wellness exam for myself, and what are the concerns that I have? So when I opened up Roots, I really wanted to make this a partnership with the clients, and really try and get to the root of a lot of the issues. And I personally think a lot of it starts with gut health and the food that we put in our bodies. I think that's sort of the you have to have a strong foundation with food and your gut biome. And I think if that's disrupted or something's off, I do feel a lot of things sort of start to stem from that. But you know, as a integrative veterinarian, one of the things that comes up a lot is, we're just looking for a clinic that's going to listen to us and not, shun us for wanting to feed an alternative type of diet or do an alternative vaccination program, or say, hey, I looked on Google and I found this. What do you think about this? And so a lot of people just come and, we have clients that are, more on the Western side, but maybe want to vaccinate less, or more on the Western side, but want to feed a home cooked diet. And they're like, honestly, we just want to have a partner with our veterinarian to support and guide us in how to do it appropriately versus telling us it's wrong, don't do it, it's bad, this is your only option. And, then we have people who are more on the holistic side. Maybe they want to feed a very specific diet, or, want to take the risk of not doing certain vaccinations. And as a veterinarian, my job and our job is to educate these clients, support them in their decisions, but also let them know, like, hey, here are all the risks that you're going to take if you take path A. Here's the risk you're going to take if you take path B. Here's all the risks you take if you take path C. And, if they're choosing the path they want or feels best for their pet, then we should support it. And, I do think that's why we have such a great clientele, good following. We're at the moment just about to start opening up to new clients again, which we haven't been able to do for quite a while. And when you have this trust with your clients, the animals benefit from it because they're coming in to see you for annual exams. They're not afraid to come in to the clinic because they don't want to get talked down to about doing something alternative. And so now this subset of pet parents and their animals who are not going to the vet every year to get physical exams and blood work now are coming back to a place because they feel that they're going to be heard. They feel that we have their pet's best interest at heart. And there's this bond that's created, which I find is great because, there's a subset of animals that are out there that weren't coming to the vets as often. And they should be coming every year to discuss, wellness, healthcare. And I find one of the most important things we could do on a yearly basis is not just heartworm and fecal checks, but checking for, any sort of issues with the kidneys or liver or red blood cells, because animals can't talk to us. And so if we get an animal who's sick, we're already playing from behind because we don't really know how long this sickness has been going on because they hide it really well. And cats hide it even better than dogs. So when you get a cat who's really sick, we're really behind. So when you have this bond with your clients and they're coming in every year, we're able to catch things a lot faster and get ahead of the illness or disease than from, playing from far behind.
Well, there's another residual effect too. Is anybody that's had a pet that's gone to a vet clinic, most animals get really stressed in a different environment. They know something's going on. And I believe strongly if the pet parents feel very comfortable with where they're going, that energy gets relayed back to the pet. So their stress level is better because generally I would think that the parents that are bringing them in, they're excited to get in there to find out what's going on and find a new program. So it carries through, I think, from an energy standpoint.
Yeah, oh, absolutely. I mean, when my wife was helping me design the clinic and the layout, the first thing we thought about is like, if we were going into a doctor's office or bringing our pet somewhere, how do we want them to feel? What do we want the clinic to look like? And I feel, and you've been in our clinic before, that it doesn't actually feel like a vet clinic with how it's laid out. We, with the plant wall that we have, we're propagating all the plants and, we try and keep it fresh and clean, and with sort of the aesthetics and, our one room with like the diffusers and the couch. I think animals here tend to be way more relaxed than, a lot of the other clinics I've been at, just because you don't have that hospital feel.
Oh, absolutely. And I can tell you truthfully, and as you know, I've been in several vet clinics. I've never been in one as nice as yours, without a doubt. And that's the truth.
Well, thank you. I can't really take a lot of credit for it because that's the brainchild of my wife, who did a great job with her vision in, bringing everything to life.
Well, she does a great job. One of the things I like about what you do too, and everything you're talking about. So when I look at like integrative medicine and I look at your approach, for you guys that are listening out there, it's kind of like you're customizing per animal. Let's dig into that a little bit and tell everybody out there why that's important and what you're doing to really make it for an individual treatment per pet.
Yeah. So my approach and what I try and teach the doctors who have joined us is that, one, I consider us more of a functional medicine type of veterinary practice. And it's really important to understand, and a lot of the holistic vets out there also understand this because it's more of the TCVM approach, which is traditional Chinese veterinary medicine. But medicine is just not, it's not black and white, right? We can read all the different types of diseases in a book and how to treat it and what we should do. However, that's just not always the case in real life. There's a standard set of rules that a lot of these illnesses and diseases will do, but there's a ton of factors. What's the client's home life like? What is the dog's personality like? What are the things that this dog likes to do every day? What is the dog eating? And we could have four dogs come in one day. All of them have arthritis, and all of them leave with a different healthcare plan or treatment based on the client's personal beliefs on what they're searching for and what they think would be best for their pet, what the animal's requirements or needs are. And so it isn't just black and white. You just can't have a dog come in and say, oh, well, your dog has arthritis. Here's your non-steroidal anti-inflammatories. Maybe the dog has, kidney issues. Maybe the client just does not want to use any non-steroidals due to the risk of affecting the kidneys and liver. So, maybe for that pet, we're going to talk about, stem cell, PRP. Maybe we'll do Chinese herbals, acupuncture, cold laser, ozone therapy, and the list sort of goes on and on of what we can do. Maybe we get a client who comes in who's like, you know what, Dr. Lassen, thanks for all these options. I personally would just prefer some meds to make my dog feel better. And that's the route that we're going to take. And I think that sort of gets to your point of, I wouldn't say we're catering, but I think we find and partner with our clients and what their needs are, what their pets' needs are, and we come up with a plan together. And we say, hey, maybe we'll try all the holistic stuff first. And if it doesn't work, then we'll go to option 2, option 3, and maybe a little bit longer of a road. Maybe it'll cost a little bit more, money financially to have a little bit more trial and error. And as long as they're on the plan with it, it's a plan that they're agreeing to versus me saying, hey, here's what we're doing, which I enjoy because it makes every day different because you're dealing with different people, different clients, different pets, different personalities, different home lives. Maybe a dog has a house that's super calm and quiet and it's just a husband and wife, or, maybe it's a home that's got, 5 kids and it's chaotic. All this plays a role in the treatments we're going to offer and discuss with clients versus just saying, hey, arthritis, boom, here's your NSAIDs. We'll see you later.
Well, the key word you said there is a partnership. You said partner, right? So it is a partnership. It's a partnership with you. It's a partnership with you and the pet, and it's a partnership with you and the pet owners. So, I mean, it's such a fresh approach versus the typical way. Not to say anything's wrong with it. It's just different. And I think it's fresh and it makes more sense, at least in today's times.
Yeah. And, I always tell people that what we do is what we do. It doesn't mean we're the best, doesn't mean we're the only way, doesn't mean that any of the other approaches are wrong. Everybody is going to find what they need, what fits best for them, whether it comes down to their beliefs, comes down to financially, coming down to, maybe it's the quality of life, end of life, and they just need to, make some quick decisions. But, it's important that there's no wrong way. I think we're all in this together, whether you're a strictly holistic vet, an integrative functional vet like myself, or truly just Western. We're all here doing the same thing and trying to provide the best that we can for these clients. And there's no right or wrong way.
I was reading one of your blogs about, and I love the way you just describe it. And I think it was a really good blog when you talk about yin and yang and how in the 90s or whatever you always had on your backpack, the yin and yang thing. But your approach to veterinary medicine, using the yin and yang, defining it as Eastern and Western, I think it would be helpful for everybody. And it comes up every now and then to really talk about the big differences between holistic medicine, which is Eastern medicine, and the traditional Western medicine, because they're the same, but they're two different things specifically. Let's kind of go in a little bit, define that for everybody.
Yeah, I would say holistic medicine and Western medicine would be your two primary groups, right? Western medicine is going to be, all your diagnostics, blood work, drugs. I guess you could somewhat throw quote unquote diet in there. And then you have holistic medicine. But under holistic medicine, you've got a lot of subcategories. So you have Chinese medicine, you've got nutraceuticals, you've got herbals, and a bunch of different modalities that sit under that. So Eastern medicine and Western medicine are just two aspects that you can look at. But there's a lot of different things that fall under holistic medicine. When you're talking about Chinese medicine and traditional veterinary Chinese medicine, there's a lot to it where you're talking about pets' personalities. You're looking for, different types of deficiencies in the body, such as qi, yin, yang, blood, and all of these are going to create different types of patterns that will help guide us in what type of acupuncture we're going to do or what type of herbals we're going to do. Maybe we're going to do something called Tui Na, which is a type of massage, and also, food therapy. Food therapy is different types of foods have different energy levels from hot to cold. So that also plays a role in it. So if you're just strictly doing traditional Chinese veterinary medicine, that's how we're going to approach it, from the exam that we do, the lifestyle, the personality, and the deficiencies, and try and correct those. Where obviously with the Western medicine, it's diagnostics and treatments. I like to live somewhere in the middle where, my approach is very hybrid. Back in the day, after I graduated from Chi University and became certified in veterinary acupuncture, I used to sort of follow the template of, all the questions, the deficiencies. Now what I do is I do that while I'm doing my Western exam, and I bring both of them together. A lot of clients tend to just want to hear what type of options there are versus going into the full depths of, what the different deficiencies mean. And so I've sort of I've meshed them together. So for example, I have a dog who comes in who's arthritic. I'll do my exam, I'll do my Western exam, I'll do my Eastern exam, and then I'll come up with a plan and say, hey, I think we should take x-rays. I think we should do maybe blood work to check kidney and liver values if we need some meds, but I'm also going to recommend acupuncture and these two Chinese herbals to help with the arthritis and the deficiencies. And so it's sort of a mix of the two.
Well, and also if the way I look at it, and this would be completely from a layman's term, but if you look at traditional medicine, for the most part, you're treating. And when you look at holistic medicine, you're doing some treatment, but you're really doing preventive medicine too, to kind of protect for having things down the way. I love the name because roots, I would never thinking about it, but if you really think about name, it's getting to the root cause, which I love the name.
Yeah, it's, there's always going to be an underlying trigger. And the hard part is, like, it could just be simply and in Austin, we have a lot of rescues we work with, and they go through a lot of traumatic experiences and stress. And that could be the root of a lot of the ailments that some of these dogs have. But, going back into it, gut health is probably the most important thing we look at. But to make it to simplify it as best as I can, I'll use a dog who's got, say, heart disease or a heart murmur. A lot of times we'll get those dogs, they'll come in, they've, are on heart medications, they've been to the cardiologist, and they're taking their drugs and they're just coming in to make sure their, kidneys and liver and all that's functioning fine just due to the drugs. And they'll come see us and say, hey, is there anything else I can do? And for myself, from the integrative functional medicine approach, I think to myself, like, why have we not talked to these clients about other options to support the heart and body while we're on medications to help keep this animal alive due to heart disease, but we're doing nothing to actually keep the heart happy and healthy.
Right.
And so to me, it's hard to understand, because even in human medicine, if you go to a cardiologist, they're going to say, hey, we got to change your diet. We're going to recommend adding in some omega-3s or ubiquinol. And I find it interesting that we're not doing that in the West, in veterinary medicine. So, for these heart cases, I mean, I'm doing everything I can to support the heart, keep the heart happy. And I find, and I would say that the cardiologists we work with will agree, that a lot of our heart patients do phenomenal and either go down on the medications they need, or live longer than what's expected based on the studies that have been out there. And that just, to me, is such a strong testament to what functional medicine can do, because it's not just saying, here's your drug, see you later. It's, hey, okay, you need to be on these medications because of the heart disease, but we're going to start supporting this body and keeping it as strong and as happy as possible. And we're going to feed that heart as many vitamins and supplements as we can to just keep that thing from progressing.
Again, it's like what I was saying earlier, was it's a mindset. And I do see a change in where I think everybody has to look at their animals the same way you look at if it's your child or a relative or yourself. You have to think of it that way, and it's just changing how you think. I don't think that anybody consciously doesn't think that way, but if you start thinking that way, the food and all that stuff affects anything else. So animals, us, whoever.
Yeah, I mean, and I would say a lot of us holistic practitioners out there, we've fought the battle for a long time where, a lot of our colleagues may not agree with what we're doing. And I don't know. I I think there's a lot to it. I mean, I think there's a fear of the unknown. Well, we don't really know what X, Y, and Z is going to cause, and it's not what we were taught in vet school. So it's inherently going to make people nervous or say that that's not right or wrong. And I think it's a lack of education, but I think that's all changing. I mean, we see it changing with the health that people want for themselves. It's happening, and I think that's the first sign of the change that occurred was with dog food. I mean, if you look back, I'm making a guesstimation, but let's just say when I came out of vet school 13, 14 years ago, the grain free movement started. And this really bucked against the system, because as vets, we're really taught, like, there's the three big companies, and whichever vet school you went to, like, that's the food that, like, you left practicing, or whichever clinic you go to, that's the food that they sell.
Yeah.
And anything outside of that is not great. And that battle still continues today. But that shift in the dog food industry didn't come from, the veterinarians. That came from the client saying, hey, wait a minute, like, I understand that these dog food companies use various grains and, byproducts because they're, not the most expensive ingredients. They have a good amino acid profile, and these companies are balancing it, and there's good science behind it. That's fine. But clients are thinking to themselves, like, but that's not clean, and there's better things we could probably feed our pets. And so you had a paradigm shift in the pet food industry, which now has grown into pre-made raw foods, to home cooked foods, balanced home cooked foods. There's veterinary nutritionists out there now that offer services for people who want to do home cooked diets. And, we're a lot further along than where we were, but there is still a true fear of any type of dog food outside of the big three companies. And while I think those companies do good work with the science and the data, I do wish that they would focus a lot on ingredients. And we know for people that ingredients matter. And, recently, I was listening to a podcast where people were talking about nutrition and what's the best diet out there? Is it, vegetarian? Is it paleo? Is it keto? And one of the nutritionists was like, honestly, at the end of the day, all of these diets are going to have some positive benefit, because most of the people who are seeing the positive changes from one of these diets is because you are getting them off processed food. You're getting them onto home cooked food, organic, cleaner eating. And when you make that shift off process, like, you will see the change. And, obviously, as a functional medicine practice, we see it all the time because we take dogs off kibble and put them on home cooked or appropriate raw, or a less processed food, and all of a sudden weight's going down, energy's coming up, less medications, chronic ear infections have gone away, and the only thing we did was change the diet. And so I find that that's probably one of the most important things. But sort of going back, it's we have to blend the worlds, and we all need to work together to benefit our clients and patients, because it can't be one way or the other. We need both sides to work together to get to, I think, the best medicine possible.
Have you seen when dogs change diets that their behavior changes?
It depends. I mean, if we're talking about, let's say you have a dog who's, just sluggish, not feeling that great, or has sort of on and off, let's say ear infections or GI issues, and you change the diet. Yeah, I mean, I see changes for the better more often than not, where people are like, wow, like, I have my dog back again. I didn't realize that changing the food would have such an impact. But the chronic issues go away, the weight goes down, and their energy goes up. And again, this isn't for all cases, but for the most part, I do find it's true that when you get dogs off processed food and to appropriate, home cooked diets or appropriate raw, like, they do better. And if they didn't, then there's no way any of us holistic or integrative veterinarians would have a job, because things wouldn't be going well for us. People wouldn't want to come see us if that was the case. But it is true. And while it doesn't work for everybody, and I don't want anybody to just go home and just quickly change the diet, because that can lead to all sorts of issues. Again, I do think making changes with food has a huge impact.
My dog that I have, I had an alternative reason for that question. So my dog that I have is kind of like my ghost co-host here. Her name's Mabel. This dog's about 4 years old. The most ADH dog. So she's a rescue. And matter of fact, her entire litter's like this. I've never seen a dog that has more energy than this dog in the world. And I'm constantly tweaking her menu. I'm doing all these things to calm her down. I've never ever had a dog like this, and it's genetic for sure, or for real, I guess is a better way of saying it. But I'm always looking for some other solution. Everybody's saying, well, get her on CBD or something like that. I don't necessarily want to do that. Not that I'm against it. I'm trying to find a different way to calm this dog down. And I can't wear her out. I could run 20 miles with this dog. She'd come home and start running circles around the house.
Yeah, I mean, when I think about it, my thought is, one, I would start looking into diets that are higher in tryptophan. So, diets that are turkey,
Turkey?
cod.
Oh, really?
Cod is high, eggs, and what supplements could we use? And then on top of that, you have a dog that's high energy. So, there's a local nonprofit dog training service here called Every Dog Austin, and they've got agility classes. So a lot of the clients that I have that have these high energy dogs, I say get them into agility class, get them a job, get them something to do, and run them. And a lot of the herding dogs that we see too, locally there are places that these dogs can go to actually herd animals and do what their genetics were designed for them, what they were designed to do. And it helps with that.
Well, anything would help with her. I mean, by the way, she's the greatest dog ever, but she is everybody sees her, they just laugh because she's mine, because everybody says I'm ADHD because I'm constantly doing 20 different things. They go, well, she's reflecting her owner pretty well then.
Yeah, yeah. I mean, my wife says I'm on the go all the time. I, stay up late working and I get up early and I'm just on the go, 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 go. So, but yeah, sometimes it's good to just sit back and relax when you can.
Well, and I know I know you're busy. Just let's talk a little bit about massage. You just touch on that. I know you're doing some form of massage and the benefits for animals. This is just for everybody out there that doesn't know much about it, so they can get a little bit educated.
Yeah, I think there's a lot to it, obviously. I think massage is one aspect of it. I do think chiropractic care is another aspect. But with massage, we're doing a lot of things. I mean, superficially, you're releasing some tension, you're sort of working those muscles, and that's just from more of a Western standpoint. When you get into deeper types of massages, you can start breaking up scar tissue. In specific with Tweena, you're doing a very specific type of massage to help break up what we would say, as an example, like stagnation. Stagnation may be energy that's blocked around the hips that's causing pain and discomfort. So we're going to do a very specific type of massage to help break up that stagnation and relieve some of that pain. You could also do acupressure, where you're doing a type of massage over an acupuncture point, where you can either tonify that acupuncture point or not tonify it and help whatever underlying issue there is for what you're trying to treat. As simply as I could put it.
Yeah. No, by the way, what I love the fact is that you're so open-minded, looking for things that's going to treat these guys really well. So I know you're in Austin. You're getting ready to take new clients on. Why don't you give for our listeners where you guys are, how they can follow you on social media, how to contact you and all that, just so it's available for everybody out there. I'll have it on social media myself, but I'm going to get, I'll pass that to you a little bit.
Yeah, the clinic is Roots Integrative Veterinary Care. We're in South Austin. Our website is roots.vet. That's roots.vet. And we also have our Instagram that is also linked to our website. And I would say, we are a local veterinary practice, but we have clients that come from all over. We've got clients that are 4, 5, 6 hours away. We've got clients in different states. And so it just goes to sort of show that there are people that are looking for integrative functional medicine for their pets. And, those that are able will travel and find clinics like ours. And I know there's a number of them across the US. And I hope as time goes on, there's more and more types of clinics like ours. So, if you're interested in it, there's a website by the Chi University. They've got to find a TCVM vet, and that'll take you to a link to find local integrative holistic vets in your area. There's the American Holistic Veterinary Medical Association. They've got to find a vet also. So not just to say, hey, come see Roots. There's a lot of us that are out there. You just got to find us.
Well, first off, for all you listening, you won't find anybody that cares more than Adam, for sure, or for real. I make my own mistake, but please go check that out. Adam, I just want to thank you so much for being on the show. You've got so much you're doing. I love your clinic. Your wife is wonderful. And really, I really, really appreciate you taking the time to be on.
Yeah, I appreciate it. And, for all those young vet students that are out there that are in the, holistic or integrative veterinary clubs, just know that there are practices out there that will support, nourish, and guide you along the journey of becoming an integrative functional veterinarian. And so, we're out here. You just got to come find us.
That's great. So everybody else that's listening, as always, thanks so much for taking the time and enjoying this. I'm sure you found a bunch of information on there, and I look forward to you guys listening some more. For real.
For real, 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 for real.
And we'll be right back. We're supported by Let's Walk, that's here to love your animals like our own.
Austin, Houston, and Denver, Let's Walk is here to love your animals like our own. From daily walks, play, in-house sleepovers, and more. Go to work, out on the town, or take a vacation knowing your pets are in the best hands. This woman-owned small business does it all. Check us out on Instagram at Let's Walk Austin, Houston, and Denver.
Hey everybody, welcome back to the second half of the show, and welcome Dr. Angie Stam. I've known Angie for a long time, and I'm really excited to have her. Angie, thanks so much for joining, and let's hear what you got to say.
Thanks, Mark. Nice to be here.
Well, I'm excited to have you. Now, I got one question for you right away. So I know you went to UC Davis, and you know I live in Texas where A&M is. What's the better vet school?
Well, that depends who you ask. I don't really have much frame of reference other than, going to Davis, so can't tell you. But supposedly Davis is ranked as number one currently.
Well, I think it's always funny because when I talk to people out here, if you talk to people at A&M, first of all, anybody in Texas, I live here, so I can attest to it. Everything's bigger in Texas. Even the rivers they call lakes. The Capitol building is like 4 feet taller than the U.S. building. It's a Texas thing. So, of course, they're going to say A&M's better, but I know both schools are great schools. But usually there's like 3 or 4 of the top ones, right? One's Davis, one's A&M, Colorado's the other one.
Cornell's always like 1 and 2, yeah.
Yeah, but you went to one, so you must be a great veterinarian.
Well, I certainly hope so. I think that there's only so much they can teach you in vet school. A lot of it you have to kind of learn through experience. You have your foundation, but then you have to get out there, and that's why they call it practice.
Right. One of the funny things I found that was really interesting when I first started getting involved in the veterinary business, generally when you talk to, a complete opposite of what I thought. So when you talk to a new vet, they'll only do things that they learned in school. They haven't figured out they can do other things. So if they weren't taught in school, they're not going to do it, which is I found really fascinating in a weird sort of way that why wouldn't you do new things? When you've got vets that have been around a while, they start figuring out things and start doing different things.
Correct. I mean, I think it depends on what mentors we have coming out of school because, but if you're just going into a traditional Western practice out of school, you're probably not going to get exposed to a whole lot of integrative or holistic modalities as much. You kind of have to seek that training out on your own at that point.
And by the way, everybody that's listening out there, you should be seeking it out too, because there are other options versus just doing the traditional ways of doing veterinary. And that's one of the things we're going to talk about. One thing I do want to talk to you about that I love that's on your website, it's a saying that you've got in there from Benjamin Hoff, which says a lot of people talk to animals, but not very many people actually listen to animals. And that's the problem.
Yeah, I think that's true. I think they have a lot to teach us if we really can check in and listen to to what they're trying to tell us.
Well, I do this all the time in these podcasts when I'm talking. It's what I've learned and I continue to learn is how similar animals are to humans. And if people would actually realize that versus thinking that they're a dog, a cat, or a horse or whatever, it's really they have the same diseases we have. They have the same things. And we would actually pay attention to that. We'd probably learn a lot more about our animals just by doing that.
Absolutely. I think that there's a lot more of that expansion that we haven't, knowledge and kind of understanding that we probably haven't discovered yet in terms of the human-animal connection. But one of the things that I sometimes see with my patients and their owners is that they sometimes share a lot of the same diseases or health conditions. And so it's really interesting. I think that there's, kind of that quantum energy field connection between humans and their animals. And not only do we share emotions, or they feel our emotions, but they can kind of energetically have similar health conditions as well.
I believe this wholeheartedly. And animals know things. They just know things intuitively or whatever. Like, for whatever reasons, animals really like me. Little kids and animals like me. Adults don't like me, but little kids and animals really like me. And it was funny. I was at this coffee shop that I go to all the time today, and a friend of mine was there with he's got a little blue heeler. And this dog is the friendliest dog ever. And these 2 girls came there, and he was scared to death of these girls. And I was trying to find out, I wonder what the deal is with that. He would not go near them. It was the weirdest thing ever. And dogs just know things. I don't know what it is that they knew, but he knew something.
Yeah. Certain people they're nervous around, or certain people they're more drawn to. Yeah, it's really interesting.
Yeah, I thought it was really interesting. So let's talk about your practice. You're located in Northern California, so let's go there and then talk about everything you're doing, because you're doing some pretty amazing things.
Great. Yeah, we are a full service integrative practice for dogs and cats, which means that in addition to the standard services that a traditional Western practice would offer, like routine wellness exams, surgery, dentistry, lab work, parasite testing, vaccinations, we go a little bit beyond that, and we offer also kind of a higher, more in-depth look at nutrition and maybe a different perspective on nutrition. We offer herbal medicine, ozone therapy, acupuncture, chiropractic, a couple other kind of stem cell therapy, a couple other different integrative cancer therapies as well. So I would say that our biggest area of support that we can offer is with the chronic pain patients as well as the cancer patients. We just have a lot more tools in our toolbox, but really managing any kind of chronic disease, Western medicine doesn't always have a lot of answers. And so we really focus on improving quality of life in animals that have chronic diseases and also preventing chronic diseases through diet, nutrition, and supplements.
Well, one of the things I saw on your website too is you do the vitamin C for cancer. And what's interesting about that, again, this goes back to what we were talking about earlier. I have a friend of mine who's in stage 4 prostate cancer, and he's looking for every alternative he can find. He's doing vitamin C himself right now.
Yeah, it's super successful in a lot of human and animal cases, and very safe, reasonably inexpensive. And it's interesting that it's not offered more widely in both the human and animal world. You kind of have to seek it out and know what you're looking for.
The other thing, like what we were saying earlier too, is if you're a human and you've got something wrong, you're going to look for anything you can to get fixed, right? Or find some other solution that's not working traditionally. And again, this comes right back to the same thing I was saying, is there are other alternatives for animals the same way as you would as a human. And you guys offer a whole gamut of them. And, let's go through some of them so people actually understand them from a better perspective.
Okay, sure. So I would say the most common modalities that we use and that are considered still on the fringe or alternative, which I don't think 10 years from now they're going to be considered alternative, but now they are. I mean, even for example, acupuncture, when I was in vet school, there was no acupuncture training offered in vet school. And now UC Davis actually has an integrative medicine service. So you can go and get acupuncture, you can get physical therapy, which is really interesting. So it's taking a while to catch up, but acupuncture and chiropractic are offered, and those are kind of now becoming even more mainstream. But we do a lot of chiropractic and acupuncture. It's so amazing how many animals have back pain and or joint pain. It's super common, and Western medicine doesn't have a lot of options, just pain meds and maybe some different physical therapy exercises and things like that. But we can go so much further with our acupuncture, chiropractic. We offer prolotherapy, which is an injection technique to help stabilize arthritic joints or torn ligaments. We offer stem cell therapy, which can be used for pretty much any health condition that you want to support, but it's traditionally used for joint disease. We do ozone therapy, which is a way of oxygenating the body, similar to how you would describe a hyperbaric oxygen chamber treatment, where you're driving oxygen into the cells, and that's creating less inflammation, helping the body to detoxify, helping to improve tissue healing, and helping to slow down the growth of cancer cells, because cancer typically prefers a low oxygen environment. So we use a lot of ozone therapy in our cancer patients, as well as our chronic pain patients, allergy patients, a host of different things.
So you'll go back to the ozone a little bit. So I wasn't aware that the oxygen would actually help with cancer. I didn't know that.
Absolutely. Yeah. There was a researcher by the name of Andrew Warburg who discovered that oxygen or cancer cells don't thrive in an oxygen-rich environment. And through the what you're doing with ozone is you're taking oxygen, O2, and you're driving it through the ozone generator to create O3. So you're adding another oxygen molecule into this electron field, and it's a very unstable molecule. And so through a
Mhm.
complex process involving the Krebs cycle and the mitochondria, it drives oxygen into the tissues and the cells.
Wow.
So it's a very safe therapy. It's very inexpensive. You can deliver ozone in a variety of ways to the body, rectally, through fluids, by ozonating the patient's blood and then giving it back to them, and also directly injecting ozone into different parts of the body. So it's a very flexible and safe treatment, and it has such a host of support, different levels of support that it can give the body, that it's a very, easy thing to integrate into a veterinary practice.
Well, a lot of the things you're doing, all the alternative things that you're doing, are usually covered by pet insurance, which for most people, they should know that as well. But the other thing most people don't realize, I mean, we do somewhat on the human side, inflammation is a big cause for a lot of this stuff. And almost everything you're doing is actually helps inflammation as well, correct?
Absolutely. Yep. Ozone therapy, chiropractic, acupuncture, intravenous vitamin C, stem cell therapy, all of those therapy, laser, all of those things in different mechanisms of action can help to reduce inflammation, make the patients feel better, have better quality of life. So they have very few negative side effects, which is really nice.
Okay, let's go back a little bit. So at the beginning of you go to vet school, and you now go out into the real world to be a practicing veterinarian. How did you get from traditional vet, I guess, techniques or whatever you want to call it, traditional medicine, and then get to where you are today? Tell me a little bit of the story, how it got you there, and why you're there.
Well, as a teenager, I suffered from chronic headaches, and my parents, my stepfather was a practicing physician, human physician, and very kind of into the Western sort of paradigm of medicine. And so they did their traditional neurologic workup on me and couldn't find any reason for my headaches. So I started investigating on my own, therapies on my own to try to help myself. And I realized that through chiropractic care and a type of stretching and body posture technique called the Egoscue method out of San Diego or Southern California, I was able to almost cure my headaches. And looking back, I think there was probably a dietary component too that I didn't really address at the time. So now that I've got that dialed in, I don't have really any headache issues at all. But I kind of learned even at a young age that the Western medicine paradigm can only go so far, and we have to have other tools. So in vet school, I actually kind of headed up the Holistic Veterinary Club, where the vet students could go and have a monthly meeting with different speakers on different holistic modalities. And then we were actually, as vet students, able to attend the holistic vet conferences once a year, where all the holistic vets from across the country would meet and have speakers and vendors. So I was able to learn, get exposed to this field at a very early stage in my career. I was able to take my acupuncture training right out of vet school at the Chi Institute out of Florida. And there's a couple different acupuncture schools for vets, but the Chi Institute and IVAS are the two big ones right now, or at least when I was coming out of school 20 some years ago. So that kind of was my first big modality and tool that I had got to add to my toolbox, which was really exciting. And at the time I was treating horses and mixed animal, goats and llamas and dogs and cats. So was able to integrate a little bit of acupuncture. And then we just started, kind of learning different tools as the time went on, different herbal classes, the ozone course, the chiropractic courses, and kind of getting everything piecemeal over time. But it was a very exciting way to do it because there was no restriction. Unlike human medicine, I could just kind of do whatever I wanted and nobody cared. I didn't have the medical board breathing down my throat saying, well, you're not certified in,
Right.
like in humans, you can't be a doctor and then just go do acupuncture. You've got to get your acupuncture certification, and it's a whole other training process. So I feel like we're really fortunate in veterinary medicine that we can expand our modalities pretty easily and have a lot more flexibility than we do in human medicine.
Well, one of the things that when I first got involved, I was really surprised when you're doing a study in the animal world. It's like 6 animals they do a thing. We do thousands of humans that are when we're going to do a study and go through all the different phases and that, which is good and bad at the same time. But at least you're able to try things that you're just not allowed to in the human world, which is, again, for you guys that are listening out there, there's a lot of other options out there. You've got one of your furry friends has got a problem. There's some other options other than that. And keep going, Angie. Sorry to interrupt a little bit, but let's talk more about this stuff because I find it fascinating.
Yeah, I mean, there's always new modalities and always new things to learn that are coming up on the horizon. Same thing with Western medicine. I mean, we always have new pharmaceuticals and new surgery techniques and new imaging, new technology in terms of imaging quality. So just like in Western medicine, you have to continually learn and grow and evolve with the tools that you have. We have that same thing in on the integrative side as well. So I'm always learning new protocols, helping to develop new protocols with the ozone, with the vitamin C, with a machine that we have now called SonoWave, which is hyperthermia combined with pulsed electromagnetic fields. And that's a great, interesting tool that we use.
Well, slow down now.
Okay.
Tell me more about this. I don't know much about this, and everybody out there too was not going to know. So explain that a little bit. Hypothermia, everything else what you're doing. Just walk it through a little bit slower.
So SonoWave, it's spelled SANA wave, and you can read a little bit more about it on my website, which is meridianvetcare.com. But SonoWave is it's a machine that increases the heat of the tissues of the body to a specific temperature. And it also combines pulsed electromagnetic fields, which are another healing kind of modality frequency, kind of like magnetic therapy where you're recharging the mitochondria. So
right.
Hyperthermia is used in human medicine as well in cancer, especially cancer treatments, where they can actually go in with a needle into a tumor and heat it up to a specific temperature range. And that actually can cause the tumor to reduce in size, sometimes encapsulate, make it easier to surgically remove. So this machine there's a dozen or so, maybe 20 vets in the country that are using SonoWave in their practices, and most of them are in the holistic kind of side of things. But it's a very safe, very gentle modality. It looks like a little heating pad that goes over the animal. And provides a gentle warming sensation for about 30 minutes. But we use it to help to slow down cancer tumors, slow down the growth of cancer. It can be used to heal disc tissue. So if an animal has neurologic disease from a disc that's bulging and pinching on the spine, it can help to heal that. And it's also great for gastrointestinal disease, pancreatitis, inflammatory bowel diseases. Anytime you have kind of this chronic inflammatory condition in the body that we really need to heat up the tissue, bring in blood flow, and that releases something called heat shock protein 70. And this protein that gets released as a result of the higher temperature signals the body to go in and repair that tissue. It's similar to the effects and benefits that we get going into a sauna, but with animals, of course, we can't put their whole body in a sauna because they can't thermoregulate as well as we can. But we can go in and target specific tissues and get that same benefit.
So is it in a very small scale? I mean, using layman terms, it's similar when you're doing hot cold therapy for yourself too?
Yeah, I think so.
Yeah.
In a sense, the heating brings in blood flow and yeah.
Everything I do is simple. So I'm always looking at the simplest thing.
Keep it simple.
Well, I've had 8 knee surgeries. So I've gone through, hot, cold to try to repair myself. So
yeah.
I understand that part, but this is interesting. I actually didn't know much about that. I mean, so you're one of 20.
About that, yeah.
Tell me some of the cases, any cool cases that stand out to you?
This SonoWave case?
Yeah.
Yeah, recently we had a little dachshund who's 14. His name's Leo, and he stopped eating, and we diagnosed him with pancreatitis, and we did our standard treatments for pancreatitis, which included ozone therapy and anti-nausea medications and some herbs and supplements and a bland, low-fat, fresh diet. And after a couple weeks, he just wasn't really responding like we would typically see. He still wasn't eating great, not feeling great. So we sent him for an abdominal ultrasound. And I'm a little worried at this point that maybe there's something more sinister going on, maybe some cancer lurking somewhere.
Mhm.
And he actually had something called a gallbladder mucocele, which is a kind of a big rubbery ball of hard mucus in his gallbladder that was blocking his bile. And he also had an inflamed pancreas. So usually that condition is surgical. They can, if it's a really big ball in there, it can actually rupture and cause them to die of peritonitis. And it doesn't typically resolve on its own. So I gave the owner the red light to pursue, or the green light to pursue surgery. And so he went to surgery, and the surgeon actually didn't end up taking out the gallbladder. They just ended up putting a little stent in there, which is actually better.
Mm.
But they said that the pancreas was like a rock, just hard like a rock. And I presume this means that there's just so much chronic inflammation in that organ that it's become kind of scarred. So we were a little worried about how this little guy is going to do. And after surgery, he did a little better, but he really wasn't bouncing back. And so this was probably now a week, 10 days post-surgery. He was eating a little bit on his own, but not great. So we added a sauna wave. We added him onto the sauna wave schedule. And, after one sauna wave treatment, he bounced back and started eating back to normal.
Wow.
And that's the only thing we did differently. So that was pretty cool. So he's coming back for some repeat treatments, but I really think that this machine has, some great healing, efficacy that we just don't have other tools to do.
So when you're typically doing this, is it a series of treatments? Like you do 6 or?
Yes. Yes, we typically sell it by a package of 8 treatments, and we'll have them come in
Okay.
typically weekly, although if it was something like a dog that was having a really bad disc flare-up, we might bump that up to twice a week.
Mm-hmm.
If they're really, really sick with GI disease, not eating, we can bump it up to twice a week. So it kind of just depends on the scenario. And oftentimes I'm combining it with other therapies like ozone, like vitamin C, like laser, acupuncture. But sometimes we just use it. It depends what the patient will allow us to do too. Some patients are needle averse, or so it's kind of nice because it's a very non-invasive therapy.
That's great. So another thing I know you guys do is a lot with pain management. And one of the things that drives me crazy out there, and I'm not pointing fingers at anybody else, but is the use of steroids for animals just to get rid of pain versus actually finding other solutions because there's better solutions. So what all are you guys doing to stay away from steroids or anything like that?
So for our chronic pain patients, typically arthritic patients or animals with really severe back pain, of course, that could fall into the arthritis category because a lot of those animals do have arthritis in their spines.
Mm-hmm.
And so we tend to combine acupuncture and chiropractic as a first line. That's the least expensive, and it's probably going to help 75% of the patients to a significant degree. If we need to go deeper, then we could look at modalities like prolotherapy, stem cell therapy, shockwave therapy, those types of things to further target the specific joints or areas that are hurting. And then we can really usually get additional significant pain relief that way. Many of these animals, we can get them off of traditional non-steroidal anti-inflammatory drugs. I don't see too many of them coming in on steroids necessarily, unless it's like a really chronic back or neck issue. But usually it's more the non-steroidal drugs, which can be harder on the gut, hard on the liver and the kidneys. So we try to get them off of those if we can. I certainly want the animals comfortable, and that's my first priority. So if we have to have them on long-term NSAID drugs, then that's fine. But we always try without, or try to reduce their need for those, maybe just use them for flare-ups and use our herbal medications and the other modalities as our sort of daily treatments.
Well, for you guys out there listening too, when you hear non-steroidal, you'll actually hear the term NSAID, which is just a short acronym for what it is.
Yes. So that would be things like kind of like Advil for us, Rimadyl, Deramax, Previcox, those Galliprant. Those are some commonly used nonsteroidals. And there's nothing wrong with nonsteroidals. But my concern is with our long-term use versus short-term use, we could be stressing organs, potentially causing leaky gut, stressing the liver and the kidneys, which are the organs that detoxify those medications. And then also when you chronically medicate with an anti-inflammatory drug, the body's never getting in the signal to go in and heal that area. So my concern is over long term, say you have a diseased knee with arthritis, if the animal's on chronic nonsteroidals, the body, I think that the joint deteriorates faster because the body never gets signaled to go in there and bring in blood flow and bring in stem cells, et cetera.
Well, you're not supposed to have drugs in your system all the time anyways. I mean, if there's alternatives out there, find the alternatives as versus being on drugs. I mean, that's the end of the day.
Right.
That's what I would think.
And I'm certainly, like I say, I'm not opposed to using them. And my first goal is to get the animal comfortable, but we have so many other tools that it's nice to maybe not have to use them as much.
So I saw on your site you have a woman that's animal intuitive. Can you walk me through what that is specifically?
Yeah, we work with Barbara Marciano. She is able to energetically connect with the animals and kind of have a deeper understanding of potentially what their medical condition is or how they're feeling or how their emotions are affecting their condition. So that's kind of a nice tool to have, if owners are open to that. It really comes into play, especially when animals are at their end of life and they're in that sort of palliation or hospice mode where we're trying to make the best decision for the animal in terms of when to euthanize. And with the help of animal intuitives, we can get more information about that animal's comfort level. And of course, we're putting that, we're judging her information along with our own experience and visual inspection and monitoring of the patient. But it's nice to have another set of information coming in to help us make decisions.
I talked to, do you know the name Dr. Carolyn Love by any chance?
No, I do not.
So she actually had a clinic actually here in Austin, but she's actually was up in Ashland for a while. Now is in the Columbian Gorge, but she's doing energy transfer remotely. She did a lot of acupuncture and did all this, and now and there's I did some research on that, and there's some interesting stories out there about these animals that calms them down, general health, just energy transfer, which is similar, I guess, what she's doing as well too, because everything has its own energy.
Of course, yeah. And I think part of it is that the owners have to be open to that too. It's not everybody's belief system or cup of tea, but it's nice to have that.
Right.
It's nice to have that tool if it's applicable.
Well, if it's me, again, and you're right, you have to be open to it, but I'm looking for any option I can find if I can take care of something. And obviously you want to try to do the least invasive one as well.
Absolutely.
And that's what I love about what you're doing, because you're giving people. When you guys go to her website, you're going to see so many other options other than the traditional way of doing things, and that's what you want. You want to figure out a way to make sure these guys are happy.
Absolutely.
So, what's the craziest animal you've had to treat? I've never asked anybody this, by the way. I always think about it, but I never ask.
The craziest. Well, how do you define the craziest?
Well, that's a relative term, right? I guess one that you wouldn't think that would be in a veterinary office. How's that?
Like what species?
Yeah, species.
Oh, okay. I haven't done a ton of exotic work. I'd say I've had a little bit of experience treating camelids, particularly alpacas and llamas, and we did have one client that had camels at my first practice that I worked at in Northern California.
I went into a clinic a while back ago, a guy that I've got to know pretty well, and he was treating a rooster. I couldn't believe it. It makes sense, I guess, at some level, but I've never ever, and this is in a big city. So he's treating a rooster in a big city. So I don't know where the rooster came from, but he was treating a rooster.
Yeah, we had a client bring her guinea pig in for a sauna wave treatment after she saw how well her dog did with it.
Oh, you're kidding.
Yeah, our guinea pig had a problem with its leg, and so she brought her guinea pig in and got sauna wave. Yeah.
Well, for all you guys out there, don't let your kids listen, or your guinea pigs are going to be going into the vet all the time.
Oh, yeah. Oh, yeah.
I don't know how many guinea pigs we had that somehow ended up in our house someplace that I've never found.
Yeah, I've never owned a guinea pig. Don't have desire to.
I didn't either. It was my kids. It was one of those deals.
Yeah.
So anything else you want to tell us about your practice that people should know about, or are we good without everything you've got?
I think that covers the gist of what we offer currently.
Well, let's do this first off. So, tell everybody how the best way, if they've got questions. By the way, you're in Folsom, California, which is outside of Sacramento.
Correct.
For everybody listening, tell everybody how to find you. All that stuff, social media or whatever else you guys are doing, so that everybody can get a hold of if they need to.
Yeah, I mean, we do offer telemedicine appointments. So we're not limited to our geographic location. If owners want to talk to me or one of our other vets about, how they could, best approach their pet's situation, we certainly wouldn't be able to, do the in-clinic treatments if they're not in our area, but we could talk about diet is a big one, and because that's kind of the foundation of healing. So we do a lot of nutritional consultations, supplements, herbal medicine. Those are all things that we can do via telemedicine. And then we can maybe be able to suggest different modalities that they could find locally, like maybe you could look and find a chiropractor or a vet who offers acupuncture, or someone in your area that offers ozone therapy, so that we can kind of help guide them to help their pet that way. And that they can just they can call or text our main number on our website.
So let's give your website address again, or even if you want to give them your phone number too, go ahead and put that out there for everybody, and then they can get a hold of you. We'll have it on social media on our end too, but just while we're talking, might as well put it out there. Of course,
sure. It's a Meridian, MERIDIAN. Meridians are the acupuncture channels in the body, by the way. So meridianveterinarycare.com.
Perfect. Now, I don't know, did I ask you if you had any animal jokes? I can't remember if I did or didn't. Do you have one? If you do, if you don't, I've got one.
You did. And since I'm a horse rider, I got you a horse joke.
Oh, perfect.
All right. So what does it mean if you find a horseshoe?
Good luck.
It means some poor horse is walking around in his socks.
Great one. That's perfect.
For real, man.
For real. I appreciate it. Okay. So for everybody out there listening, I say this every time at the end of our segment. So if you've got a joke and you want to be on the show, if you send it to me at mkyle, Kyle, at forreal, 2 R's, podcast.com. And if you've got one, we'll record it. We'll put you on, or it can be one of your kids, one of your friends, whatever you want, do that. And also, if you've got something you think that would be a relative thing for the show, let us know that too. You never know. Maybe it's a story you've got about your pets, a friend that's doing really crazy things or wonderful things. And just let us know. Again, Mark Kyle, mkyle at forrealpodcast.com. Angie, thanks so much for being on the show. I know it takes time, but I really think it's important for people to get the information you were talking today, and I really appreciate you taking the time.
Absolutely. It was great chatting with you.
Well, everybody else out there, thanks again for joining us. Pass the word out. We want more followers, obviously. The more people we have, the more information we find too. So thanks for listening, and always hang out with us for real. Bye-bye, everybody.
For real, for real, for real, for real, for real, for real, for real.
We are supported by PrepVet, providing stem cell therapy for pets.
As a pet lover, did you know your pet can benefit from the incredible healing power of stem cell therapy? Prep Therapy offers a groundbreaking solution taken right from your pet's own blood. Say goodbye to joint pain, arthritis, kidney and liver conditions, and more. They'll experience faster recovery, increased vitality, and extended quality of life without the need for surgery or harmful drugs. Put the wag back in their tail and discover Prep Therapy today at prepvet.com. Save 10% with promo code FurRealPodcast, covered by most pet insurance.
That concludes this episode of For Real with your host, Mark Kyle. For previous and future episodes of For Real, listen via all major podcast streaming sites.